If you've ever wondered which supplements actually make a difference during menopause and which are just hype, this video is for you. Today we'll cover the top 5 that are proven to help with energy, mood, sleep, bone health and hot flashes. And wait until you hear about the one most women overlook. It could be the missing piece your body's been craving. Vitamin D3. Nearly half of the global population is low in vitamin D, and deficiency becomes even more common and more problematic after menopause. Vitamin D3 is essential for bone strength, immune function, muscle health, mood, and metabolic balance, making it one of the most important supplements for women in midlife. Why it matters during menopause. Falling estrogen accelerates bone loss, raises the risk of fractures, and affects muscle strength and metabolic health. But vitamin D helps your body absorb calcium, maintain bone density, support vaginal and urinary health, improve insulin sensitivity, and may even reduce the risk of certain cancers in women with low levels. What are the testing and ideal levels? A blood test can help determine whether you are low, especially if you rarely get sun, have osteoporosis, or experience bone or muscle pain. Many experts consider 30 to 60 nanograms per milliliter an optimal range for women in midlife. Recheck levels after 2-3 months if you start or change your dose. How to take it? Always pair vitamin D3 with K2, which helps direct calcium into your bones instead of soft tissue. Take it with a meal containing some fat, ideally in the morning, as it can disrupt sleep for some if taken in the evening. Magnesium also helps your body activate and use vitamin D, so taking them together is often recommended. Magnesium. Magnesium is involved in over 600 vital processes in the body, yet up to 75% of people are low in it. During menopause, hormonal changes make magnesium even more important for managing stress, mood, sleep, and bone health. It calms stress and anxiety. Often called nature's Valium, magnesium helps regulate your body's stress response. Low levels make you more reactive to stress, creating a vicious cycle. Supplementing magnesium can ease anxiety, calm the nervous system, and protect the adrenal glands from stress overload. Lifts mood. Magnesium supports neurotransmitters that regulate mood and helps lower inflammation linked to depression. Research shows that increasing magnesium intake can significantly improve symptoms of anxiety and depression, sometimes as effectively as medication. Improve sleep. By supporting GABA, the brain's main calming neurotransmitter, magnesium helps quiet the mind and relax the body. It regulates melatonin and eases muscle tension, leading to deeper, more restorative sleep. Strengthens bones. Magnesium works alongside calcium and vitamin D to maintain strong bones. It activates vitamin D and helps regulate calcium transport, reducing postmenopausal bone loss and osteoporosis risk. Daily use and dosage. Most women benefit from daily magnesium, since consistent levels are key for better mood, sleep, and bone support. The recommended daily amount for women over 30 is around 320 milligrams. Best forms to take. For menopause symptoms, magnesium glycinate is highly absorbable and calming, great for sleep and anxiety. Magnesium taurate also supports relaxation and heart health, while magnesium L-threonate may enhance focus and memory. Some supplements combine this for broader benefits. Vitamin B12. B12 is one of the most important nutrients for women in midlife, and its deficiency can lead to serious and potentially irreversible conditions, such as severe anemia, nerve damage, memory loss, and cognitive decline. B12 is found almost exclusively in animal products, so supplementation is important for anyone eating mostly plant-based. But don't let that put you off. The benefits of plant-based diet far outweigh the need for one simple supplement. From far fewer menopause symptoms to more energy, easier weight loss, and lower risk of chronic disease, it's absolutely worth it. Also, after 50, vitamin B12 deficiency becomes more common, no matter what diet you follow. As we age, our ability to absorb B12 from food declines, and by the time we reach 60, up to 20% of adults are deficient, with rates climbing even higher as we get older. Additionally, certain medications can further hinder B12 absorption. Why it matters? Low levels can cause fatigue, brain fog, low mood, tingling sensations, and even memory issues, all of which can mimic or worsen menopause symptoms. B12 keeps your energy, nerves, and brain functioning properly. Boosts energy. B12 helps make red blood cells and supports energy metabolism, reducing menopause-related fatigue. Supports mood and mental health. It helps protect nerves, regulate stress, and reduce anxiety and depression. Keeping B12 levels healthy also lowers the risk of cognitive decline later in life. Protects heart and bones. Alongside vitamins B6 and folate, B12 lowers homocysteine, high levels of which are linked to heart disease and osteoporosis, both bigger risks after menopause. Due to age-related absorption drop, the added stress of menopause, and its critical role in energy and nerve function, B12 supplementation is highly recommended for menopausal women. How much to take? Adults 2000 micrograms once a week, ideally as a chewable, sublingual, or liquid supplement. But those over 65 need 1000 micrograms daily. Choose cyanocobalamin for its stability and proven effectiveness, or methylcobalamin if you have kidney issues. Pro tip: if you suspect a deficiency, the most accurate test is urine MMA, not serum B12, which can be misleading. Omega-3s. Omega-3 fatty acids are especially valuable during menopause, when estrogen decline raises inflammation and increases risk for heart disease, mood issues, and bone loss. Their powerful anti-inflammatory effects help ease many menopause-related symptoms. Why omega-3s matter in menopause? Heart health. Omega-3s lower triglycerides, support healthy blood pressure, and protect against heart disease, risks that rise after menopause. Mood and brain. Omega-3s nourish brain cells, support serotonin and dopamine, and may reduce brain fog, anxiety, and depression. Bone and joint health. Omega-3s help slow bone loss and reduce joint pain and stiffness caused by inflammation. Skin and vaginal dryness. By improving cell membrane hydration, they support supple skin and vaginal comfort. Sleep quality. Adequate omega-3 levels may improve melatonin production and sleep. Best omega-3 source. Fish oil is common but often contaminated with mercury, PCBs, and microplastics. They are linked to various diseases including cancer, autoimmune disorders, dementia, Alzheimer's, and heart disease. A cleaner and much safer choice is algae-based omega-3s, and algae is where the fish primarily get the omega-3s from too. Choose an algae supplement with both EPA and DHA, aiming for around 250 mg daily. Valerian root. Valerian root can be especially helpful during menopause for improving sleep, easing anxiety, and even reducing hot flashes. Key benefits: better sleep. Studies show that valerian improves sleep quality in menopausal women, especially when combined with calming herbs like lemon balm, hops, and passion flower. It works by boosting GABA, a neurotransmitter that calms the nervous system. Fewer hot flashes. Research suggests valerian may reduce the frequency and intensity of hot flashes, possibly due to its mild phytoestrogen effects. calmer mood. Its soothing properties can help relieve anxiety and mood swings linked to hormonal changes. In summary, valerian root is a gentle, non-hormonal option for easing several menopause symptoms. It's generally safe for short-term use, though some may experience morning grogginess or vivid dreams. So, there you have it, top 5 supplements that help during menopause. Just remember, always talk to your healthcare provider before starting any new supplement, especially if you take medications. Your doctor can help determine the right dosage for your individual needs and ensure that any supplement fits safely with your overall health and medications. And if you found this video helpful, give it a thumbs up, subscribe for more science-backed menopause tips, and share it with a friend who deserves to feel her best too. Thank you for watching, have a lovely day, and I will see you in the next video.